Minnesota Department of Human Services. How to complete a Minnesota healthcare program's renewal for families, children, and adults. Families with children and adults under 65 who do not have a disability and receive medical assistance or MinnesotaCare through the state of Minnesota are required to complete a renewal every year. The renewal notice is sent to enrollees through the U.S. Postal Service. Households may receive more than one renewal notice during the year, depending on the household's program eligibility. There are 3 types of renewal notices you could receive. Each type requires a different action for you to take. Let's look at each of the notices, so you can determine the right action to take. The first type of notice is the Auto-Renew notice. If you receive an Auto-Renew notice, it means coverage for everyone in the household has been renewed automatically. If you received an Auto-Renew notice, you will be able to identify that because all the people in your household will have the action of Auto-Renewed. Individuals listed on the Auto-Renew notice were redetermined using the existing household information on the case. You must review all the information on the Auto-Renewal notice to make sure it is accurate. If it is not, make corrections by crossing out the incorrect information and writing in the correct information. Then, return the corrected Auto-Renew notice and information summary pages in the provided envelope. Please include any proofs along with the new information. This must be done within 30 days. If all information is correct, you do not need to return the Auto-Renew notice and information summary pages. The second and third type of renewal notices are the Need to Renew notice and Combined Renewal and Results notice. They look different than the Auto-Renew notice and have additional requirements and timelines for returning the renewal. You will receive the Need to Renew notice. If eligibility for everyone in your household who are due for a renewal requires a renewal form to determine their eligibility. The renewal form must be returned to review the eligibility for everyone who is due for a renewal. You will receive the Combined Renewal and Results notice if the eligibility of some household members who are due for a renewal has been automatically renewed, and eligibility for other household members requires a renewal form to determine their eligibility. The renewal form must be returned to review the eligibility of the household members whose eligibility was not automatically renewed. If you receive a Need to Renew notice or a Combined Renewal and Results notice and renewal form, you must review all the information listed on the enclosed renewal form. You will know that you received a Need to Renew notice or a Combined Renewal and Results notice if it says, "It is time to renew your healthcare coverage," on the first page of the notice. All household members who need to renew their eligibility will be listed on the Need to Renew notice or Combined Renewal and Results notice. When reviewing the Combined Renewal and Results notice, the next section will list all the household members who have had their eligibility automatically renewed. This will not display on the Need to Renew notice because the Need to Renew notice is only sent when no one in the household had their eligibility automatically renewed. This page of the Need to Renew notice and Combined Renewal and Results notice has answers to commonly asked questions. It explains that people whose eligibility was not automatically renewed may experience a gap in coverage if the renewal form is received after the due date listed on this page. It also explains that if you do not return your renewal form at all, coverage for the people whose eligibility was not automatically renewed will end. This page also has contact information if you have more questions about your renewal. The next pages in both notices show what you need to do in 4 steps. Step 1 is to review the information on the renewal form. Step 2 is to update any old or incorrect information and fill in any missing information. Attach a sheet of paper if additional space to provide the information is needed. Step 3 is to sign and date the form. Lastly, Step 4 is to mail, fax, or drop off your completed form to your servicing agency by the due date listed on the form. The Save Time Now section tells you about information you can include to speed up the processing of your renewal. You can include proofs, copies of pay stubs or tax returns, for all household members who have income. The Get Additional Support section provides a website and telephone number to help find a Navigator staff person near you. Navigators can assist with completing renewal forms and answer questions about the forms and your healthcare case that you may have. This service is provided at no charge. Included in the renewal is a page that lists the number to call if you need free help interpreting your renewal. The images shown in the video will depict the pages from the renewal. All the pages that you will see contain information we have about your household. You must review each section of the renewal form. Update any incorrect information and fill in any information that is missing. To update your renewal, cross out any incorrect information and write in the correct information in the box below. Attach additional sheets of paper if needed. It is important to remember that if you return the Need to Renew form late, unsigned, or with incomplete information, your eligibility for coverage will end. The first section of the renewal form is the household information. This section lists all members of your household, their gender, date of birth, marital status, pregnancy status, whether or not they are an applicant or if anyone is deceased. Update or add missing information as needed. Note that household members should include yourself, your spouse, your children under 19 that live with you, as well as your spouse's children under 19 that live with you, your unmarried partner, if you have children together, anyone you include on your tax return, even if that person does not live with you, and anyone else under 19 that you take care of and that lives with you. If you need to request coverage for someone that is not currently enrolled in a Minnesota healthcare program, or you need to add a new household member, call the servicing agency listed in the return address of the notice. The next section displays member relationships. Review each household member's relation for accuracy. Update or add missing information as needed. For residency, make sure the information is complete and accurate. Update or add any missing information. For Social Security number, review each member's information. To report a newly acquired Social Security number, call the agency to report the number, or write it on your renewal. Individuals not applying for healthcare coverage do not need to submit their Social Security number to the agency. If an individual has healthcare coverage or is applying for health coverage, they must provide their Social Security number if they have one and if they haven't provided it yet. For citizenship, review the information for accuracy. Make any updates or changes as needed. If someone in your household did not have citizenship before, but has citizenship now, make sure you have provided that person's Social Security number so we can verify their citizenship. To save time later, you may also include paper proof of that person's citizenship, such as a copy of their naturalization certificate or U.S. passport. For some, the next section is non-citizen information. Note that if you have told us that everyone in your household is a citizen, this section will not appear on your renewal. If the information displayed on your form is no longer accurate, correct the information on the form. To save time later, you may also include paper proof of that person's citizenship, such as a copy of their naturalization certificate or U.S. passport. Review the tax filing information in the chart for your household. Make updates as needed. Review the information in the Other Health Insurance Information chart and make updates as needed. Note that other health insurance may include employer insurance, private insurance, TRICARE, Medicare, COBRA, etc. If coverage through an employer is reported, an Appendix A will need to be completed if any household member is offered employer insurance, but is not enrolled, either due to declining the coverage or being in a waiting period. Accurate income information is vital to getting the correct healthcare eligibility. Review the income information we have about the members in your household. If there is incorrect, missing, or duplicative information, be sure to write that on the renewal form. Cross out any incorrect or duplicate information. Report any new income information that was not listed on the renewal form in the Report New Income section. Be sure to complete all columns for each new income listed. If there is not enough space to add all income for all household members, include your case number and answer on a separate sheet of paper and return that with your completed renewal form. Be sure to include all taxable income you receive. Some types of income you may receive are wages, salary and tips, interest, dividends, capital or other gains or losses, unemployment compensation, self-employment income, and RSDI or SSDI benefits, just to name a few. Adjustments to income are the types of expenses you would list on the Schedule 1 when you complete the IRS 1040 federal tax return. Review the adjustments to income information we have about the members in your household. If there is incorrect, missing, or duplicative information, be sure to write that on the renewal form. Cross out any incorrect or duplicate information. Report any new adjustments that were not listed on the renewal form in the Report New Adjustments to Income section. Be sure to complete all columns for each new adjustment listed. Projected Annual Income, or PAI, is the total income each household member expects to receive for the entire year, starting on January 1st through December 31st. This includes income you would list on your federal taxes, plus untaxed Social Security benefits, tax-exempt interest, foreign income, and lump sum payments. There is information at the top of this page which instructs you on how to calculate your PAI. Review the information in the PAI chart. Circle Yes if the PAI amount listed is correct. Circle No if the PAI amount listed is not correct. If it is incorrect, write the correct amount in the New or Correct PAI Amount column. The Other Information section applies to all household members. Review each bulleted question. If the answer is yes for anyone in the household, use the box below to explain which question the answer is yes for and write the name of the person answering yes. Some people may be eligible for MA under different categories. You can read information on that in the Full Medical Assistance Determination section. The last section is Renewing Coverage in the Future. You are asked to select the number of years that you give consent to use your tax return information. If you give consent, your tax return information is used to verify and potentially renew your eligibility for help to pay for health coverage. That way, we might be able to renew your eligibility for health coverage electronically. If all individuals on your case are renewed electronically, we don't need to ask you for information. If you do not check a box, you are agreeing to the use of your tax return information for 5 years. Once the renewal form is complete, review the information on the signature page. Then you need to sign and date the renewal, or it will not be complete. If you had help from a navigator, assister, or broker, they will need to fill in the section below your signature. Voter registration information appears on the end of this page. If you are eligible to vote, you can register at the website listed. The last pages of your renewal form are informational. They do not need to be returned with your renewal. They include information on how to use your healthcare coverage and what to do if you have questions about your healthcare coverage or questions about the renewal forms you received. There is a page that provides details on when an agency may recover costs that the MA program paid for its members. There are also pages that list your appeal rights, civil rights, and how to request an interpreter if you need one. The last step is to return your renewal. Using the envelope provided, put in the completed renewal form, additional copies of pages or extra sheets, and any pay stubs or tax returns, or any other proofs. Add the necessary postage to the envelope and be sure to address it to the state or local agency that is in the upper left corner of the cover page of the Need to Renew or Combined Renewal Notice. You can also return the renewal by fax, or you can drop off your completed form to your servicing agency by the date listed. You can visit mn.gov/DHS/renew my coverage to find out about other ways you can submit your renewal. In some cases, submitting your renewal will complete your process. However, you may be contacted after your renewal is submitted. After submitting the renewal form, you may be asked to provide more information, such as proof or clarification. If so, you will receive a request for information. This letter will list the additional information you need to provide to complete your renewal process. If you don't send the information by the due date listed on the request, your agency will be unable to determine your eligibility for healthcare programs, so your healthcare coverage could close. After you have submitted your completed renewal form and returned any requested information, you will know your renewal process is complete when you receive a renewal eligibility notice. This notice will tell you each person's new eligibility determination, the date their new eligibility is effective, and the program they are eligible for. You can contact your agency with questions about your renewal if necessary. The Renewal Eligibility Notice has a section on "What if I have questions about this notice?" which provides contact information. Copyright 2025, State of Minnesota Department of Human Services. Produced by Minnesota Department of Human Services, 444. Lafayette Road, St. Paul, Minnesota, 55155. 651-431-2000, toll-free, 800-657-3663, toll-free TTY, 800-627-3529. Video phone, 651-951-1514. Website, https://mn.gov/DHS.
The Minnesota Department of Human Services, DHS, prohibits discrimination in its public services because of race, color, creed, religion, political beliefs, national origin, sex, public assistance status, marital status, age, sexual orientation, or disability. Direct discrimination complaints to the DHS Civil Rights Coordinator at dhs.info@state.mn.us or 651-431-2000. Individuals with disabilities may request reasonable modifications to receive DHS services by contacting its Americans with Disabilities Act Coordinator at dhs_ada@state.mn.us or 651-431-3040.